are you doing today?
Hi.
My name is Victoria and I'm the student nurse practitioner. How would you like your name to be addressed?
Gina is fine, thank you.
Okay, Gina. I have washed my hands and we've taken your vital signs and they're all within normal limits, so that's really good. So what brings you in today?
What brings me in is that I have this very itchy spot on my left elbow.
Okay.
And it's not getting any better.
Okay, and then when did you first notice this itchy spot on your elbow?
Noticed it about a few months ago, I think. And it's just not getting any better. So I figured I should probably come in.
Well, I'm glad you did. That way we can assess and see what's going on. And looks like it's located on left cubital, which means left elbow. That's just a fancy medical term that we use. And do you have it located anywhere else, these spots, this itching?
No, I don't have it anywhere on my body. I do know that my mom has a similar itchy area on her arm, and she has been diagnosed with psoriasis.
Okay, so you're kind of worried that it might be the same thing or just seeing if it's similar potentially?
Yes.
Okay, and is there anyone else in your family that has this itchy spot, the psoriasis? Anyone else that you've been told about?
No one else that I'm aware on my mom's side of the family, and on my dad's side, I have not been told that anyone has that as well.
Okay, that's good. Well, I'll ask you a couple more questions and see if potentially this is psoriasis or maybe something else, okay?
Okay.
So you said, when did this start again?
Started a few months ago.
A few months ago? Okay.
Yeah, about 2 to 3 months ago.
3 months ago. And then have you noticed any changes in this since 3 months ago? Like the changes in your size, the duration of it, anything like that?
So I have noticed that it just becomes itchier. When it first started, it was a little bit itchy, but now it's become worse. Okay. So in order to temporarily relieve it, I started using hydrocortisone cream. Okay. And it does relieve the itch a little bit, but as soon as that hydrocortisone wears off or just comes off, then it starts itching again.
Okay. Anything else that relieves it that you've noticed?
Nothing that I've noticed.
And any other characteristics that you've noticed outside of that itching? Has it gone any bigger in size or no?
It has not gotten any bigger. Just the itchy part about it, and just whenever I put that cream on it, it just temporarily relieves it, and that's all I've noticed for now.
Okay. Anything that makes it worse? Like any
just
aggravating
whenever
factors?
Just whenever I don't put cream on it, it just gets worse. I feel like it just gets a lot itchier.
Okay. And then have you noticed any time of day that it gets worse, or just only with stress that you've really noticed it?
I did notice that it gets worse a little bit with stress, or maybe in the morning, and then throughout the day and at night. So yes.
Okay. And then how severe is the pain, like from 0 to 10, 10 being the worst?
I would say the itchiness is probably between 7 and 8. Mm-hmm. When I put the cream on, it does relieve it quite a bit, probably between 3 to 4.
Okay. And then, let's see. I'm just gonna ask you a couple more questions here. Is there any medical history that we need to know about for you? Any like diabetes that you might have, or high blood pressure, any heart problems, lung concerns, any diseases that we need to be aware of?
Nothing that I'm aware of on my mom or dad's side. Just my mom was diagnosed with that psoriasis.
Okay, and then what about for you personally? Anything that we need to be aware of for medical?
For me personally, no. Nothing that I'm aware of.
Okay, so nothing for you and your family minus the psoriasis for your mom?
Yes.
Okay. And then have you had any surgeries that we need to know of, or any surgeries that you've had recently?
I have not had any surgeries.
Oh, okay. And do you smoke or chew? Any tobacco products that you use?
No tobacco, no chewing.
Okay. And then any illicit drugs that you use, like any illegal drugs that we need to know of? I mean, that you use?
No, none at all.
Okay. And then do you drink any alcohol?
I do. More like a social drinker though, so between 2 to 3 times a week I'll drink socially.
Okay. And then when you drink, how many drinks do you have? Like 1, a couple, 5? Can you explain
I'll
that a little?
probably have between 2 to 3 glasses of wine whenever I drink. Yes.
Okay. And then when you do drink, have you noticed any changes to your lesion that you have?
I do notice that it does tend to get a bit itchier and a bit worse when I am drinking, yes.
Okay, you noticed that. And then do you have any allergies to anything?
No allergies.
Any medications that you're on? Mine is that hydrocortisone cream that you've tried.
I'm not on any other medications, no.
Okay, any over the counter, like any Tylenol, ibuprofen, or any supplements, any vitamins?
No.
No, okay. And then let's see. Well, I'm gonna go ahead and assess you, okay, and see kind of what's all going on. So I'm gonna first measure the size of that lesion that you have here. So it's 2 centimeters by 2 centimeters. Duration, it is like a white scaly color, silverish, and then also pink erythemus, that's kind of like a reddish color underneath. When I do scratch at it, it has that auspice positive sign, which can be psoriasis related as well. And you can go ahead and relax your arm here. I'm gonna set this down. And then have you noticed any joint pain, fever, chills, anything like that?
Nothing at all.
Nothing that you've had?
No.
Any weight changes, weight loss, or weight gain?
Nothing.
Nothing? Okay.
No.
So let me know when I assess your skin if anything hurts. Your skin is nice and cool, warm to touch. Do you ever feel clammy? And clammy is kind of like a sweaty feeling. Do you ever have that?
No.
Nope,
Never
all
had
good.
that.
Alrighty, nice and warm. I'm gonna just check your capillary refill. That's kind of like the blood flow return. So we want that to be less than 3 seconds. Perfect, and that's less than 3 seconds. Very good. Your nail beds are nice and pink. The nail bed curve is 160 degrees, which is good. We want that. Smooth nail bed, no rough edges, no ingrown, anything that I see abnormal. And I'm just gonna look at your toes here as well. Capillary refill is also less than 3 seconds. Looks really good. Anything hurt when I do that?
No.
Nope, perfect. Very good. And then looks like if I was to remove, look at the legs, the skin under there, if she had shorts on, under her shirt, everything looks normal. Looks really good. And is there anything else that we need to be aware of for you that you're having concern that you want to be seen for outside of this?
Nope, just a spot on my elbow.
Okay. So what we're gonna do is we're gonna try some triamcinolone cream, and that's just like another steroid medication that's stronger than hydrocortisone, since you said that that helped you a little bit but not much. So take that twice a day, put it on just a thin little layer on your lesion, and we'll see if that helps with your itching, relieving it. And give us a call in 2 weeks, let us know how that's doing. Try and see if you can find ways to cope with that stress with you going to school. That can be pretty stressful. Try like some deep breathing exercises, taking little breaks in between as well. I know that can be a little tough sometimes, finding ways to relieve stress.
Yes.
Go on walks. Walks are really good exercise. Do you do exercise?
Whenever I can, yes.
Okay. How many times a day, how many times a week do you usually do exercise?
Probably 2 to 3, so not much.
Okay, and how long do you usually do it for when you do your exercising?
Probably between 20 to 30 minutes, so not too much.
Yeah, well that's pretty good. That's a good start. That way at least it helps a way to relieve stress, get some fresh air, especially now that we're having those crisp, cool mornings coming up here in North Dakota as well. So just let us know. We'll send that medication over to your pharmacy.
Okay.
If that doesn't help, we might have to refer you to the dermatologist, okay? That way they can inspect. But we'll kind of start with that cream and go from there.
Perfect.
Alrighty, well, it was nice meeting you, Gina.
Thank you very much.
Yeah, thank you.